Good evening and welcome to tonight's presentation for the American Academy of Podiatric Practice Management's Certified Medical Office Manager Program, otherwise known as the CMOM Pod. We're going to give our listeners just a few more minutes to get on, and then we'll go ahead and start tonight's presentation on employee management. All right, we'll go ahead and get started. Like I said, thank you so much for attending. Welcome. Some quick housekeeping items before we get started this evening. Let's see. Sorry about the delay. We're just having some technical difficulties here. Like I said, in regards to housekeeping for this evening, as a reminder, all listeners are on a listen-only mode, but that's why we need to take full advantage of the question bar on your screen. Please feel free to ask questions while the presentation is being given, but we will be addressing all questions in full and the answers at the end of the webinar. So go ahead and ask away. We'll be addressing everything at the end. Now, this program is being recorded and will be posted to the AAPPM's website a little later, so you can always go back in reference to it again. Lastly, don't miss the upcoming AAPPM Fall Symposium. That is going to be this November in San Antonio. We have a great track planned, and in addition to an exclusive office manager track, this is also going to be your first opportunity to sit and test for the CMOM pod. Now, San Antonio is going to be very busy this week, and there's a large sporting event going on, and hotel rooms are selling out quickly. If you have not already made your reservation, now is the time to do so. You won't want to miss this fall symposium, and you really will want to be part of the very first class of CMOM pods. So we look forward to seeing you this November 10th through 12th in San Antonio for the Fall Symposium. With that, like I said, tonight we're going to be talking about employee management. This section is going to be divided into 3 parts. This evening, we're going to be reviewing how to create and post an employment advertisement when you're needing 2 members, and then how to conduct an interview. Our next webinar, part 2 of employee management, is going to be reviewing employee relations and the law. All the legal things we need to know and make sure we're following when we are handling our team members. The last section of employee management is going to be reviewing not only how to hire and train an applicant, but the employee handbook. If you don't have one, this is something you need to have in your office. Lastly, at that point in time, we'll also be reviewing employee discipline and dismissal. First things first, you need to determine who it is you're looking for. Before you can even create a advertisement or post a job ad, you need to first find out what it is you're looking for. There are a couple of different things to determine, including personality. Now, the personality that you're looking for will vary depending upon the position that you're hiring for. Think about if you're looking to hire a marketing coordinator versus a collection specialist, for example. Your marketing coordinator should be a bright, enthusiastic ray of sunshine, someone who's never met a stranger in their life, whereas a collection specialist should be someone who is not afraid to be assertive and stand their ground when it comes to collecting the monies owed to your practice. This is just an example of some different personality attributes that you should think about when creating an ad for a specific position. One thing to keep in mind is, do you want someone who's going to be naturally happy and smiling, or are you okay hiring a new team member who has an on-stage persona and is going to be turning it on and off? That's something to think about when we're creating this ad. When we're interviewing, there are some nonverbal cues that can tell you a lot about a person's personality. Are they maintaining eye contact? Do they have a firm handshake? And what about their posture as well? Remember, your team members will be interacting with your patients and possibly community members with these nonverbal cues in addition to how they're interviewing with you. These are all different ways that you can tell what type of personality the applicant has. In addition to personality, you also need to think about skill set prior to creating an employment ad. Does experience matter to you? Now, if you won't hire someone unless they have experience, does it matter what the experience is? If you're hiring for a medical assistant, will you only hire someone who has experience working as a medical assistant in a podiatry office? What if an applicant has experience working in dentistry or another specialty? Also, when it comes to experience, how long do you want that experience for? Do they have to have experience for 6, 12 months, over a year? These are all questions to discuss and have answers to prior to creating that employment ad. In addition to experience, what about the degree or education? Again, using the example for medical assistants, will you only hire certified medical assistants, certified nursing assistants, or are you willing to hire someone who does not have the degree or education that you're looking for? Obviously, this is always in compliance with your state regulations. You need to keep in mind, what can you train? As the manager at your office, you're the trainer. So remember, what skills can you train a team member versus what soft skills are they just stuck with? I believe we can train team members to do anything, especially when we have a comprehensive training manual, an office protocol manual that we'll be discussing in an upcoming webinar. But some soft skills and personality traits people are born with, and they're not so easy to train and change. After you've figured out what type of personality and skill set you're looking for, you can then use this information to create a job description and job duties. This is a very vital step that many people forget and overlook. When we're interviewing new team members, this is a guideline in regards to what it is we're hiring them for. It is our job as the office manager and interviewer to at least have this guideline, the job description and job duties, ready to show team members so they know after reading through if they can accept this position or not. How are they supposed to know if they can fulfill our duties and our needs if it's not written down? Here's a simple example of a job description for a medical assistant. It not only reviews what the position is and who they report to, but some other information about the position, and then duties of the position are a completely separate document. This is something, once the employee has accepted the position, that is signed and dated, This is something, though, that you need to have prepared based upon the personality and skill set that you've previously determined is necessary to excel within a position. Once we have that personality and skill set and we've created the job description and job duty, you can then move on to creating the actual employment ad. An extremely important step when it comes to creating the ad is asking the applicant to follow directions or complete a task. Some simple examples include having a specific subject line in the email, such as, "I am your new medical assistant," or "I am your new team member." Additionally, the email or the application must answer why the applicant is best fit to join our team, and maybe include 3 professional references. Maybe you'll have specific wording including attach your resume via Word document or PDF. And lastly, no phone calls. You don't want to be clogging up your phone lines and busying your receptionist with answering phone calls from applicants. Emails only. These are 5 simple tasks, 5 examples. And this is just an easy way to weed out those applicants who cannot follow directions. Think about it. If someone can't change an email subject line, do you want them to be the face of your practice? Do you want them marketing your practice or assisting with your patients? If someone can't follow simple directions, it's someone you don't want in your practice. In addition to following tasks and directions, you should also be mindful of spelling and grammar. This person may be acting as a scribe for your physician, and we need to make sure all of our documentation and notes are accurate, and spelling and grammar is important. Or if you're hiring someone who's going to be marketing your office, every position is an extension of your physician and needs to be able to show the standards and quality of your practice. So it's of the utmost importance to make sure an applicant can follow a simple direction or task, and it's an easy way to weed out those who cannot. When it comes to posting an employment ad, there are multiple different online job boards you can use, including Craigslist, Monster, Indeed, Career Builder. These are just some examples. When it comes to online job boards, you need to be cognitive of what online job boards cost money and what you think your return on investment will be for that, versus what boards are going to be complimentary. Keep in mind, with the job market and the applicants that you're looking for from the skill set and the personality that you've predetermined, where are your applicants going to be looking for a new job? Are they going to be looking in the paper, or are they going to be on Craigslist? Don't forget about schools and universities. Many times they'll have online job boards or even a career center. You can post a bulletin in. You can contact these universities and schools, and they have fresh candidates who are looking for positions just like those that you're offering. You can partner with them, and it can be a win-win situation. Additionally, your Chamber of Commerce, if you're a member, may have benefits, including a job board that you can post to. Keep in mind, when it comes to community, what organizations you're a part of that you can utilize when you're looking for a new team member. Don't forget about your social media sites, including Facebook or Twitter or Pinterest. These are all part of your online marketing that you should already be utilizing, but it's another way that you can look for team members. Your patients are the ones who are following you and are part in seeing your social media presence. And who knows you better than your patients? They already know what your standards are and what the office is like, so they will know which one of their friends or family will fit perfectly for that new position or that new hire that you're looking for. Don't forget your own website. So many times people post to these online job boards, but we have our own website that's so frequently overlooked. You could have a dedicated web page on your website that's solely dedicated to jobs, to positions within the office, talking about the atmosphere in the office, what open positions are available, how to apply for the position. It's already on there. Utilize what you already have. Now, a very adverse topic is headhunters or attempt to hire agencies. Nearly all the time, this is going to be an investment, and you need to determine if it's going to be worth it or not. Do you want to start off with a headhunter or attempt to hire agency and before you go online with the job boards or you contact your universities or Chamber of Commerce? Or would it be in your better interest to utilize your social media, your website, online presence before having to pay for a headhunter or attempt to hire agency? If you're utilizing a paper ad, keep the ad short and direct the applicants to your website. This is why you have a dedicated web page all about your help wanted ads. Usually when it comes to paper ads, you are paying for everything, so you want to make sure that you're keeping it short and just directing them to your website. When it comes to posting an ad, you can also email, fax, or even mail help wanted flyers. You can utilize your patient list because, again, who knows you better than your patient population already? And your community partners. So many times we forget that we've developed relationships in our community, and we can utilize these relationships when we're looking to add to our team. If you're having difficulties filling a position, try extending the radius of your search or of your posting. If you're having applicants apply who are outside of the radius that you're posting, that can be a good suggestion as to where to extend your radius. Pardon me. Lastly, don't forget about just going out to the coffee shop, the mall, the salon, and handing out your business card. You never know when you'll find the next perfect team member who will be an excellent addition to your team. This is why it's of the utmost importance to keep your business cards on you and hand out when you find that perfect team member who's just looking for a new position. When it comes to the interview itself, first off, we have the phone interview. The phone interview is a very useful tool because it's a quick and cost-effective screening to help narrow down your candidate choices, and it gets you that very first impression. Especially if you're hiring for someone who's going to have phone contact with your patients, this is a great way to see how they triage or how they handle phone calls. What is their phone voice? Can you see or tell their personality through the way they're talking? If you're hiring for a receptionist, this is going to be an extremely important part of your interview process. When you're doing a phone interview, this is a way to determine if the candidate is going to be worth an in-office interview or not. You'll all have to excuse me, I have a tad bit of a head cold, so I do apologize for the coughing. Moving forward from the phone interview, next you have an in-office interview. This is what many people are familiar with, and we'll be reviewing some specific questions that you can review. When you're inviting a candidate into the office, there's many different questions and question types, but Unlike many of our competitors, you don't just want to stop there. In addition to the phone interview and the in-office interview, you should be doing a working interview. The working interview is having a candidate do a task. When it comes to the working interview, the candidate or the applicant is going to be shadowing or helping with the position within the office. This is another way that, again, you can assign a task to see if the applicant can complete the task or not. During the in-office interview, if you believe a candidate is worthwhile in inviting back into the office for a working interview, assign them another task, such as take a look at our website or a social media page. What questions does the candidate have about it? What did you learn, or what would you change? I'd like to refrain away from asking what did you like best about it, because someone can very easily say, I thought the color scheme on your website was very cohesive and visually pleasing, without even looking at your website. This is just one more way, one more screening technique that you can use when you're interviewing your candidates. When it comes to the working interview, when they are helping shadowing another position, you want to make sure that you are observing them. You should have them sign a confidentiality notice and obviously check your state regulations or in regards to the legalities behind this working interview. The big question that I always get is how many interviews is enough? We reviewed 3 here, a phone interview, an in-office interview, and a working interview. But the answer is interview an applicant as much as you need to until you're sure that this person is the right addition for your practice. Remember that you should always hire slowly. Take your time. Don't hire the first person that you interview unless they pass all of the criteria that you have created. Interview as much as needed until you're confident this person will perform what you're needing. During the interview itself, there are a couple of different interview styles you can use. The first example of an interview style is behavioral, or CBI, which is clinical behavioral interviewing. Basically, what CBI is it's saying that the past performance is the best indicator of that applicant's future performance, or history will repeat itself. Basically, how that candidate performed in the past in a similar situation is a pretty good indicator of how they're going to do again in a future scenario. CBI concentrates on having a psychological reason for people's actions or why they're doing what they're doing, the choices your applicants are going to be making. Now, behavioral interview styles, those questions are based around past performance. So some examples would be, describe a time that you did this job. Give an example. Can you tell me about a time that you did this? All of your behavioral-based questions revolve around past experiences. You're going to ask the person to give you examples from their past. Moving on from behavioral-based interviewing to task or test-oriented interviewing. Task interviewing is essentially just having a problem-solving interview using exercises to demonstrate their abilities. Some very common examples of a test interview includes a typing speed, typing accuracy, and don't think that you have to do just one of these interview styles. Obviously, you would not hire a medical assistant after only giving them a typing speed and accuracy test. You'd also have them in the office and maybe ask them about how they reacted to some situations in the past to give you a good idea of how they'll react when those situations present themselves in the future. You can use a combination of the different interview styles. Some other types of interview styles include stress interviewing. Now, basically, stress interviewing is a rare type, but it essentially works upon finding weaknesses that your candidate has to see how they perform under pressure. Some examples of how to make your interview stressful to see how they perform include awkward silences during the interview, constant interruptions, repeating your questions, firing your questions at the applicant. Keep in mind, if you're going to try this, you're not just interviewing the applicant, but the applicant is interviewing you as well. This could backfire and have a negative result on the interview process. You can try a few of them, but you do not want to have an entire interview be a stress interview. You don't want to give the candidate the impression that working at your office is going to be this stressful. Another interview style is non-directive interviewing. When it comes to non-directive interviewing, it's a much less structured style, and it's just more conversative, going back and forth and asking open-ended questions to the applicant. Some examples of non-directive interviewing styles would include, how would you handle this? What would you do in this scenario? Or tell me about this. Again, it's a very open, more conversative interviewing style. When it comes to interviewing, remember, there's no right style. Usually, interviewers use a combination of different styles to get the best results or best data to determine whether or not this applicant will be a good addition to your practice. During the interview, remember to dive deeper and ask why. In this day and age, especially, applicants are trained. They're going through sample interviews and they are being scripted on what to say for the answers. What this means for us as managers is that the very first answer they give to a question is most likely going to be scripted and possibly not be completely true. Once they answer a question, you want to dive deeper and ask why. Why do you feel this way? Why did you handle this situation in the manner that you did? Why did this happen in your past? Or what would you have done differently? Another way to keep your candidates on their feet is to switch between your standard interview questions and more abstract interview questions. Obviously, everyone has their standard questions of, why do you want this position? Why are you best fit for this position? Tell me a little bit about yourself. What do you know about our practice? How could you contribute to our practice? How have you related with past employees, past coworkers, and patients? What experience do you have? But if you switch those questions up, where the answers are usually scripted, with some more abstract questions, it's really going to keep the applicant on their feet. Some examples include, what is your favorite color and why? Because I'll tell you what, if someone tells me their favorite color is green because it symbolizes springtime and regrowth and they're a bright, bubbly person just like the color, I'm more likely to hire that candidate versus someone who says their favorite color is black, like the pit of their soul. So, you can really find out some things about the candidate when you're asking these abstract questions. Tell me about your favorite vacation. If you could be an animal or tree, what would you be and why? And then some of these abstract questions could get you around some questions that you can't ask, which we'll talk about at the next slide. But if you ask a candidate to describe your closet to me or describe your garage to me, usually at that point in time, they may end up disclosing if they're in a relationship or not, which we obviously do not want to ask. If you are trying to hire someone who needs to be detail-oriented, then they should be describing their closet, how it is color coordinated, and it goes from short sleeves to 3/4 sleeves to long sleeves, and then they have their pants and their shorts or their capris, versus someone who may be a little bit more out there saying, my dirty clothes are in a bin, my clean clothes are not. When you're asking them these questions, you can really start to get to know their personality a little bit better. Remember, during your interview, to answer the unasked questions. How is your applicant interviewing with your team and with your patients? These are the people they're going to be interacting with every single day if they're hired to become your new team member. Ask your team members how this person interacted with them. How did they interact with patients? If you happen to be hosting your interviews during patient hours, if a patient walks in, did your applicant get up out of their seat to allow the patient to have a seat? What about their arrival time? Were they late? If they're late to their interview when they're trying to portray their best self, that's a pretty good indicator if they're going to arrive to the office on time or tardy. And how do they introduce themselves? Are they confident? Are they making eye contact? Do they have that firm handshake? These are all questions that you should be answering even though they're unasked. Obviously, there are some questions that we cannot ask. For example, if you want to know about their age, you cannot ask, how old are you? What is your date of birth? Rather, it's appropriate to ask, are you at least 18 years of age or older? When it comes to disability and health, you cannot be asking about disabilities, diseases, inability to handle stress, medications, drugs. These are all things we should not be asking, but it is appropriate to instead ask, how can you handle stress? Or can you perform a specific job duty such as loading paper or whatnot? When it comes to marital status, again, it doesn't matter if your applicant's married, single, divorced, separated. This does not pertain to your position by any means. Some of those abstract questions may end up disclosing this information to you, but again, marital status is not applicable towards the position itself. When it comes to children or child care, you cannot ask if the applicant has children. How old are your children? What kind of child care arrangements have you made? Do you plan to have children? Are you pregnant? Rather, a better way to inquire is to ask that this position requires dependable job attendance and frequent last-minute overtime. Would you be able to meet these requirements and expectations? This is an appropriate way to inquire about your applicant's children or child care. Now, our next presentation is going to be all about the law and employee relations. This is just a small part, and those specific law questions should and will be asked and answered at our next presentation. I do want to go ahead and review the employee management quiz at this time. The questions from the quiz can all be found in the section and were reviewed in this first segment of the employee relations webinar. Now, to begin with, for the first question, why is it important for you to have an applicant follow directions in their applying process and to answer a few questions about themselves? As discussed, the correct answer is B. You want to ask them questions and see if they can follow directions so you can see before you even schedule an interview if the applicant can follow directions or not. Question 2. Why is it so important to have a phone interview? The correct answer is C, which is both A and B. It's important to have a phone interview prior to having an in-office interview so you can screen the applicant before setting up that in-office interview, and it's an easy way to weed through the many applicants you have so that you can narrow down the choices. Question 3. What are some examples of inappropriate face-to-face interview questions? Regardless of whether it's face-to-face or over the phone, these are all inappropriate. And the correct answer is A. How old are you? Are you married? Do you have children? None of these are appropriate and should not be asked during any phase of the interview process. Question number 4. What are some examples of appropriate reference check questions? The correct answer is A. Why did the applicant leave the position? What was the nature and length of your relationship with the candidate? You cannot again ask if the candidate is married, has children, age. These are all inappropriate. Question number 5. How would you appropriately phrase a question to find out if the candidate has children or not? The correct answer is C. This position requires dependable job attendance and frequent last-minute overtime. Can you meet these requirements? Asking, do you have children? Do you plan to have children? Do you have a child care provider? Are all inappropriate and should not be asked during any phase of the interview process. Moving on to question 6. How would you appropriately phrase a question to find out how old the applicant is? The correct answer is D. Are you at least 18 years of age? Asking, what is your date of birth? How old are you? Are inappropriate. Moving forward to question 7, how would you appropriately phrase a question to find out if the applicant had a disability or health problem? The correct answer is A. How well can you handle stress? What medications are you on? Do you have any disabilities? Are you on any drugs? How many sick days did you leave? These are all inappropriate questions. We cannot be asking that. Question number 8. How many interviews is recommended to fully connect with the applicant? The answer is D. Conduct as many interviews as you or your physician may feel comfortable with in order to get fully connected with the applicant. Take as much time as you need. Hire slowly. Question 9. What is an example of internet-based ads for employment? The correct answer is D. All of the above. Indeed, Craigslist, Facebook are all examples of internet-based ads you can post employment at. Lastly, question 10. What is a working interview? The correct answer is B. A working interview is an interview where the applicant is shadowing or helping in the position for a day. Those are all of the questions for this module's quiz. At this point in time, I'm going to ask Brooke if we have any questions from our listeners that we can address.
Not tonight, Sam, we don't. I think you did a pretty good job of outlining getting started with that interview process and finding those correct candidates for your office. Gave us a lot of good insight into some different questions to ask. I know in our office one of our favorite ones to throw people off is if you, what am I going to find out about you in 6 months that I don't know today? Mm-hmm. And it's interesting some of the answers that you will get. So find some of those, odd questions that really throw your person off. So like Sam said, they're not giving you scripted answers. Gives you good personality insight.
Absolutely, Brooke. I could not agree more. Like I said, in this day and age, the answers are scripted. They have been trained on what to say, and if you ask them, if you were a tree, what type of tree would you be? If you were to pack my lunch, what would you pack for me? You'll really get to know your applicant better. If that was everything for this evening and there are no questions, that's the end of tonight's webinar. I thank you all for attending, and I do apologize for my voice. We look forward to meeting with you all again for our next webinar and seeing our very first class of CMOM pods in San Antonio this November. Thank you so much.
Take care of that cold and feel better.
Have a great night.